Have you ever experienced the shame of ejaculating in less than 2 minutes, leaving your partner unsatisfied and making you feel less of a man? Have you tried all kinds of mental tricks, like thinking about unpleasant things or doing math calculations during sex, only to discover that nothing works and you still ejaculate almost immediately after penetration? Do you feel trapped, unsure if this problem has a solution? Assuming you'll have to rely on expensive medications with side effects for the rest of your life? Or perhaps you've completely avoided sexual intimacy because the fear of failing again is stronger than your desire. If you're over 40 or 50, if you suffer from premature ejaculation, if you've lost confidence in your ability to satisfy your partner, or if you simply want to learn how to control your ejaculation naturally without relying on pills, this message could completely transform your sex life. I'm Dr. Sánchez, a specialist in preventive medicine and men's health, and today I'm going to reveal to you the 5 exact, practical, and scientifically proven steps that can help you eliminate premature ejaculation naturally without medications, using only behavioral techniques and lifestyle changes that have been shown to work in thousands of men. Stay with me until the end, because I'm going to give you a complete step-by-step protocol that you can start applying today, allowing you to last 10, 15, or even 20 minutes or more in bed, regaining your confidence in your sex life. To understand why these 5 steps work, you first need to know what premature ejaculation really is and what causes it. Premature ejaculation is medically defined as ejaculation that occurs within the first minute of penetration or before the man desires it, causing significant distress. There are 2 types: primary premature ejaculation, which you've had all your life since your first sexual experiences, and acquired premature ejaculation, which appears later in life after having had normal ejaculatory control for years. The cause of primary premature ejaculation is usually neurobiological: low serotonin levels in the brain or hypersensitivity of the glands. Acquired premature ejaculation, on the other hand, usually has psychological causes like performance anxiety, stress, depression, relationship issues, or physical conditions such as prostatitis, hyperthyroidism, or erectile dysfunction. But regardless of the type you have, there's a very important behavioral and mental component that can be modified with specific training. Your brain has learned a pattern of rapid ejaculation, and with conscious, deliberate practice, it can relearn a pattern of delayed and controlled ejaculation. It's not magic. It's neuroplasticity applied to your sexual health. Imagine for a moment the devastating impact premature ejaculation has on your life and your relationship. Every time you're with your partner, you feel enormous pressure. Anxiety starts even before you get to the bedroom. You wonder, am I going to fail again? How long will I last this time? What will she think of me? That anticipatory anxiety is already sabotaging your control. When the moment of penetration finally arrives, you're so nervous that your sympathetic nervous system, the one associated with stress, is hyperactive. You penetrate, feel a wave of intense pleasure, try to hold back, tense your muscles, think about something else, but it's useless. In 30 seconds or a minute, you ejaculate. Your partner hasn't even started to get aroused. You feel humiliated, frustrated, powerless. She tries to be understanding, but you can see the disappointment in her eyes. Over time, sexual intimacy disappears. You start avoiding sex. Your partner feels rejected and undesired. The relationship cools, conflicts increase. Studies show that premature ejaculation has a profound negative impact on quality of life, self-esteem, and partner satisfaction. It's not just a sexual problem. It's one that affects your identity, your relationship, and your happiness. Many men, desperate for a solution, fall into serious mistakes that worsen the problem. Some use anesthetic creams on the glands to reduce sensitivity. This may work temporarily, but it also numbs the partner's vagina, eliminating her pleasure, and can cause loss of erection due to lack of sensation. Others try masturbating hours before sex to empty out and last longer. This rarely works well and can cause sexual fatigue. Some resort to extreme mental distraction, thinking about disgusting or painful things during sex to avoid ejaculating. This emotionally disconnects them from the act, ruins intimacy, and turns sex into mechanical work without pleasure. Others use the method of firmly squeezing the glands just before ejaculating, but this is uncomfortable, interrupts the rhythm, and can cause pain. And many simply resign themselves, thinking they were born this way and there's nothing to be done. But before you fall into despair, I want to share the scientific truth that's transforming lives. Yes, it is possible to eliminate premature ejaculation naturally, without medications, using specific behavioral techniques validated in clinical studies with success rates over 70%. Let's get to the 5 steps. Step 1, the most fundamental, master deep diaphragmatic breathing and learn to recognize your point of no return. Ejaculation is a reflex triggered when you reach a critical arousal threshold known as the point of no return. Once you cross it, ejaculation is inevitable and unstoppable. The problem for most men with premature ejaculation is that they don't know how to identify when they're close to that point. Arousal builds and builds, and suddenly they've ejaculated without realizing it. The first step is to develop body awareness. During solo masturbation, practice stimulating yourself slowly and pay full attention to your sensations. Identify your arousal level on a scale of 1 to 10, where 10 is inevitable orgasm. Learn to recognize when you're at level 7 or 8. That's your danger zone. While stimulating yourself, practice deep diaphragmatic breathing. Inhale deeply through your nose for 4 seconds, filling your abdomen, not your chest, and exhale slowly through your mouth for 6 seconds. This breathing activates your parasympathetic nervous system, the relaxation one, and counteracts sympathetic activation that speeds up ejaculation. Practice this for at least 2 weeks, 3 or 4 times a week in 20-minute sessions until you can clearly identify your arousal levels. Step 2. Apply the start-stop technique known as the Masters and Johnson or stop-start method. This is one of the most effective techniques for retraining your ejaculatory response. Once you've developed arousal awareness from step 1, now actively practice controlling it. During masturbation, stimulate yourself until you reach an arousal level of 7 or 8, just before your point of no return. At that moment, completely stop all stimulation. Breathe deeply. Consciously relax your pelvic muscles, glutes, and thighs, which tend to tense up. Wait 30 seconds to a minute until your arousal drops to 4 or 5. Then resume stimulation. Repeat this cycle of stimulation, stop, relaxation, resumption at least 5 times in a 20 to 30-minute session before allowing yourself to ejaculate. At first, it will be difficult, and you may fail several times by ejaculating before stopping. That's normal. With practice, your brain and body will learn to recognize the signals and control the response. After 2 or 3 weeks of solo practice, involve your partner. Explain what you're doing. Ask her to stimulate you manually or orally using the same start-stop technique. Communicate clearly when she needs to stop. This open communication is not only part of the treatment, but also strengthens emotional intimacy and reduces anxiety. Step 3. Incorporate the squeeze technique. Developed by sexologists Masters and Johnson, this is especially useful when the start-stop technique alone isn't enough. When you feel close to the point of no return, instead of just stopping, you or your partner apply firm finger pressure to the head of the penis, specifically where the glans meets the shaft, just below the corona. The pressure should be firm but not painful for 10 to 20 seconds. This temporarily reduces ejaculatory urgency and may cause a partial loss of erection, which is fine. Wait 30 seconds to a minute, then resume stimulation. The squeeze technique is especially helpful during penetrative sex. Withdraw, apply the squeeze, wait, then repenetrate. At first, it will interrupt the flow, but with practice and partner communication, it becomes more natural. Many men who combine start-stop with the squeeze technique increase their ejaculation time from 1 or 2 minutes to 10 or 15 minutes over 8 to 12 weeks of consistent practice. Step 4. Strengthen your pelvic floor muscles with Kegel exercises for men. The pelvic floor is a group of muscles stretching from the pubic bone to the tailbone that controls urination, defecation, and yes, ejaculation too. When these muscles are weak, you have less ejaculatory control. When strong, you can consciously squeeze to delay ejaculation. Kegel exercises for men are simple. First, identify the right muscles. Next time you urinate, try stopping the flow midstream without using your hands. The muscles you contract are your pelvic floor muscles, specifically the pubococcygeus muscle. Once identified, practice contracting them for 5 seconds, then relax for 5 seconds. Repeat 20 times, 3 times a day. You can do this anywhere. Sitting at your desk, driving, watching TV. No one will know. Over time, increase contraction duration to 10 seconds. After 6 to 8 weeks of daily practice, you'll notice much greater conscious control over your ejaculatory response. During sex, when you feel ejaculation approaching, strongly contract these muscles for 10 to 20 seconds while breathing deeply. This can significantly delay orgasm. Step 5, perhaps the most underestimated but crucial. Reduce performance anxiety through open communication with your partner and focusing on mutual pleasure without pressure. Anxiety is the #1 enemy of ejaculatory control. When anxious, your sympathetic nervous system activates, releasing adrenaline and cortisol, lowering your ejaculatory threshold. You need to break this anxiety cycle, and the most effective way is to remove pressure from sex. Talk openly with your partner. Explain that you're working on improving your ejaculatory control. Ask for her patience and understanding. Set up sensate focus sessions where the goal isn't orgasm or penetration, but simply exploring each other's bodies, giving mutual pleasure with caresses, kisses, oral sex without performance pressure. This eliminates anxiety and allows you to relax. Practice pleasuring your partner with your fingers, mouth, or sex toys. When she's satisfied first, the pressure on you dramatically decreases. Often, when a man focuses on his partner's pleasure first and helps her orgasm before penetration, anxiety vanishes completely and ejaculatory control improves naturally. Also, consider mindfulness and meditation techniques. Practicing 10 minutes of daily meditation can lower overall anxiety and improve your ability to stay present during sex instead of getting lost in anxious thoughts. Imagine Roberto, 58 years old. For 20 years, he suffered from premature ejaculation, ejaculating in less than a minute. His self-esteem was destroyed. He decided to apply these 5 steps disciplinedly. In the first month, he practiced breathing and start-stop solo 4 times a week. In the second month, he involved his wife. They practiced the squeeze technique and sensate focus without pressure together. In the third month, he added daily Kegels. At 12 weeks, Roberto could last over 15 minutes with penetration. His wife was happier than ever. His confidence soared. Roberto didn't take a single pill. He trained his body and mind naturally and scientifically. Of course, these 5 steps require commitment, discipline, and patience. It's not an instant solution. You won't see results in 3 days. But with consistent practice over 8 to 12 weeks, the results can be permanent. It's essential to understand that if your premature ejaculation is caused by an underlying medical condition like prostatitis, hyperthyroidism, or very low serotonin levels, these steps alone may not be enough and you'll need additional medical treatment. If after 3 months of disciplined practice you see no improvement, consult a urologist or sex therapist. In some cases, combining these techniques with fast-acting SSRIs may be optimal, but the vast majority of men with premature ejaculation can improve dramatically with these behavioral techniques alone. You don't have to resign yourself to ejaculating in 1 or 2 minutes for the rest of your life. You don't have to depend on anesthetic creams or expensive pills. You have the power to retrain your ejaculatory response naturally and permanently. Every conscious practice session is an investment in your sexual confidence. That's choosing to age with control, potency, and the ability to fully satisfy your partner. If this information has given you real hope and a clear action plan, like this video, subscribe to the channel, turn on notifications, and share it. Thousands of men suffer in silence from this problem and need to know there's a natural, effective solution. Remember, ejaculatory control is a skill that can be learned. Start today. Be patient with yourself. Communicate with your partner. Practice consistently. The results will come. I'm Dr. Sánchez. Thank you for trusting, for informing yourself, and for taking control of your sexual health. See you soon.